The OPD service delivery moved to telehealth, engaging with patients via both telephone and video consultation. This was achieved via the Attend Anywhere platform. In conjunction with the dietetics department, we are enhancing patient care post-COVID through the identification, assessment and management of sarcopenia.
Social work is a relationship-based profession. We place significant emphasis on the importance of connection and to promote patients' well-being. We've adapted our practice to include remote working, telephone and video sessions for patients and families, and visual aids for supporting those in isolation.
It's a very exciting and challenging time to be a medical scientist, embracing all of the new molecular technology and being immersed in the world of virology. We have implemented 2 new molecular testing methods for SARS-CoV-2 using our Gene Expert platforms and BioFire Film Array Torch. Through doing this, we are now able to provide a 7-day service for COVID testing. This means that for inpatients who present to ED, they can have their COVID status determined on site and can be dealt with in an appropriate and time-efficient manner. And for inpatients awaiting discharge to other hospitals, and for patients awaiting discharge on a home care package, they can also get their results rapidly, which saves time and money.
The Occupational Therapy Memory Strategy Education Group is a 6-week programme that helps our clients manage memory impairment in their everyday lives. The programme usually runs on site in Naas General Hospital. In order for us to continue to deliver the programme, we now work in partnership with the Monreid Community Centre, who have provided us with a very large space so that we can socially distance and deliver our programme.
Clinical engineers are the technical problem solvers in healthcare. Clinical engineers fed into the National COVID-19 Information Hub and the Hospital COVID Oversight Group. Staff extended their hours 8 to 8, 7 days a week and redesigned their own work environment. They looked after double the quantity of equipment, stock and supply chain. They fed into medical gas utilisation, decontamination and sterilisation services, and facility redesigned to provide additional COVID bed capacity.
The pharmacy department extended its opening hours to work weekends also to provide timely delivery of medications to patients and to offer clinical support to nurses and doctors. The guidelines for medical management of COVID patients were evolving continuously, and pharmacists kept the teams and nursing staff up to date on any changes. Pharmacists were involved in the rollout of the vaccine programme within the hospital and were involved in the supply and storage and governance of the vaccines. They also answered any queries that staff may have had in relation to the vaccines.
COVID-19 pandemic has affected how patients and clinicians experience communicative interaction, with all staff having to wear personal protective equipment. The impact of wearing visors and masks has created barriers to communication. The SLT service, in trying to optimise communication between staff and patients, have come up with ways to try and facilitate effective communicative interaction. We have used name badges with our faces and names to personalise PPE. We've used whiteboards to optimise communicative interaction, for example, people with hearing impairment. And lastly, using iPads to facilitate communicative interaction, social interaction between patients and families.
Telehealth enables the diabetes dietitian to provide online carbohydrate counting to patients with type 1 diabetes. These sessions teach patients how to better control their diabetes through insulin and diet management. The Dietitian First Gastro Clinic is also now being run online as a video consultation, allowing patients to receive patient care in a timely and efficient manner.
The Pulmonary and Sleep Diagnostics Department has been impacted amazingly through COVID-19. We've had to implement brand new techniques, hygiene and service-wise, and one of our techniques is we are starting a new in-car service this week to be implemented in Naas General Hospital.
So prior to COVID, Naas General Radiology offered a walk-in service for all GP chest x-rays and query fractures. However, to comply with COVID restrictions and social distancing in our waiting areas, all patients now require an appointment and must complete a COVID questionnaire prior to presentation in the department.
Happy HSCP Day!